Newhalfen here of Northwest Indiana Chiropractic Health. We are talking about temporomandibular dysfunction, or for many people known as TMJ. And what I'm going to do is I'm going to take you through a couple tests that I run in my clinic, and then some potential ways, things that I recommend for treatment options. And where my approach differs from even dentists, where a lot of dentists are doing mouth guards and they're working more on the structural component of the jaw, what I'm focusing on, which complements dentists and orthodontists very well, is I'm working more on changing the function of the jaw and the way that it actually opens and closes, and then the way that the muscles and the ligaments and everything are controlling the jaw. So, I get quite a few referrals from dentists because it complements very much so the night guards and then the treatments that they're doing. And so, thank you to Anna for letting us use her as an example. And so what we're going to do first is I'm just going to have her, I'm going to palpate the TM joint. I'm going to have her just nice and slow open her jaw. Good. And at the end there, she gets some nice clicking in her jaw, right, Anna?
Yes.
And so what I want you to do is follow the arc of her chin and open again. And on the way up, you'll see it jut towards the ceiling right there. And again, just so everybody can see. So see how it juts up right there, instead of coming in a nice arcing C. And what that does is it causes a misalignment of the jaw and leads to some clicking, grinding, well, not grinding, some clicking, some early arthritis, and then a lot of muscle imbalance. And so one area of focus for us would be just to start correcting how she opens and closes her jaw using various exercises, some home training. Now the jaw is very hypermobile by trait anyway, so there's too much movement here. So it's not something that we're often manipulating or adjusting the jaw. It's more a lot of some soft tissue work, some rehab exercises, different kinds of home exercises and home therapy programs. And so one other place that I check that a lot of other people don't is actually inside the mouth. So the medial and lateral pterygoid muscles, which control the jaw going from side to side, and they kind of control what the jaw does as you open. So if, for instance, she opens and she snakes to the right, it could mean that she's got a muscle imbalance on those pterygoids. And so what I'm going to do is I'm going to go inside her mouth and just palpate or feel those pterygoid muscles to see if there's any kind of knots, and she can tell you, all right, there's a nice little knot, and then right here, and she's not a lot of fun in there. And so bone is not tender, so she can tell you that this is pretty tender. And what I'm going to ask you is, when I push here, it's tender, but does it start referring pain to your temple, to your eye, or anywhere else? No. Okay, so really what we're looking for is, yeah, some of these things are tender, but we're looking for the hot spots or the hot trigger points that are referring pain other places. About 50% of headaches have some kind of jaw component, and so a lot of times we can go in the jaw and find a trigger point that's referring pain and just really start working it out with some different techniques we use here in the office, as well as teaching the patient some things to do. And so we can go in here and check the other side. And oh, she's really, really tight on this left side. And she can tell you that it's, it's not a lot of fun, but it works, and it can work really quickly. I've changed the way that people open and close their jaw in anywhere from a couple weeks to a month to, a couple months, depending on their brain and how they do with the home exercise program. And so really, I think that's the big reason why people come to me for TMJ or temporomandibular joint dysfunction is, the mouth guards are great and they're a good idea, but they also need to change the way that their jaw is opening and closing, and essentially the way their jaw is functioning. And so when you really combine the structural change, the mouth guards, and some, other kinds of things with the functional, is when you really just get great results. And so that's, once again, I'm Dr. Robert Newhalfen of Northwest Indiana Chiropractic Health, and I'm located in Schererville, and I have a location in Crown Point, and I'm actually soon opening up and doing some hours in Munster, Indiana as well. I can be reached at 219-322-6942. Thanks. Have a great day.